So we start with our next sexually transmitted infection, that is Donovaniasis, also called as Granuloma Inguinale. So Donovaniasis, the Granuloma Inguinale, is a chronic, progressive, ulcerative genital infection caused by the Klebsiella granulomatis, previously called Calymatobacterium granulomatosis. It causes painless, beefy red, bleeding genital ulcers without significant lymphadenopathy. This is the SBA which has been asked. The causative organism of Donovaniasis is what? Okay, so it is a Klebsiella granulomatis, or previously it was called as Calymatobacterium granulomatis. Please remember this. This was the SBA which was asked. Okay, coming to the etiology, it is a Klebsiella granulomatis. Okay, it is similar to the Klebsiella, and things from the examination point of view, if asked organism, it is a gram-negative intracellular bacillus. Okay, so gram negative intracellular cocci was what? Gonococci was cocci. Okay, and here, yeah, and here it is a bacillus. Okay, gram negative intracellular bacillus. Okay, so key diagnostic feature is a Donovan bodies inside the macrophages. Okay, so primarily it is a sexually transmitted, most common in the elderly population, that is 20 to 40 years, variable transmission rates. Okay, unlike chancroid, the lymphadenitis is not seen. Unlike syphilis, there is no indurated painless chancre here. Okay, so chancroid will always be a painful inguinal lymphadenitis is seen in chancroid, while in Donovaniasis, the lymph node enlargement is rare or uncommon. Okay, so we have to differentiate Donovaniasis, chancroid, and primary syphilis. There is no pain in Donovaniasis also and primary syphilis, but chancroid is a painful. Okay, so lymphadenitis is more common in chancroid and syphilis. It is rare in Donovaniasis. Ulcer base is beefy red. This particular word you should remember. Beefy red, you think about Donovaniasis. And the drug of choice also, I have told the first only single drug.
Only azithromycin.
There here it comes the azithromycin. Okay, that we will see subsequently. This bleeds on touch. Okay, Donovaniasis, this will bleed on touch. Okay, this is a very short. Okay, so you see that this ulcer will be hard to feel in syphilis. Painful nodes, painful ulcer plus nodes, you will have think about chancroid, and beefy red, bleeds and touch, and no nodes, Donovaniasis. Okay, so initial lesion is form of papule or subcutaneous nodule, and later it will progress to the ulcer. Okay, so there are four types of the presentation in Donovaniasis. The most common is a ulcer of granulomatosis. Okay, so that is the typical beefy red, exuberant, and bleeds easily. Okay, so painless and bleeds on touch. The others are hypertrophic, necrotic, and sclerotic. So these are the other types, but the most common is ulcerogranulomatous, that is beefy red, exuberant, and bleeds easily. Hypertrophic is a raised irregular growth which will have a walnut appearance. Necrotic will be deep, foul-smelling ulcer. It will have tissue destruction, and sclerotic will be fibrotic and scarred lesions will lead to the chronic fibrosis. There will be genital lesions in 90% of cases. In men, pupus, coronal sulcus, glands. In women, there will be labia minora, foresheet, etc. Inguinal region is 10%, extragenital is 6%. Okay. So special situations, lesions grow rapidly in pregnancy. Dissemination is rare to the liver and bone, associated with cervical lesions in pregnancy. Can mimic complicated spinal squamous cell carcinoma, etc. So if these lesions do not heal, think of the biopsy. Okay. Now coming to the lab diagnosis, tissue smear stain with Giemsa stain. You will see large mononuclear cells, intracytoplasmic cyst, Donovan bodies, gram-negative and bipolar density capsule will be visible. Okay, so septipin appearance inside the macrophages. Think of Donovaniasis. Okay, and on histopathology, you will see the plasma cells and polymorphonuclear cells, and the staining is either Giemsa stain or the silver stain. Okay, so in-house nucleic acid amplification you can do, and there are no other commercial tests available. Culture is rare, not done routinely. Serology is also not reliable. Now coming to the management. So take samples before antibiotics. Do not delay the treatment. Screen for other STIs. Continue treatment for 3 weeks. So another infection where the treatment is for 3 weeks or until the complete healing is there. So here the drug of choice is azithromycin, 1 gram weekly for 3 weeks. Okay, or alternative will be 500 milligram daily for 3 weeks. So there are two conditions where the 3 weeks treatment is required. One is a LGV, and other is a Donovaniasis. Okay.
Donovaniasis.
Okay. Then here alternative will be cotrimoxazole, that is 960 milligram BD. Then doxycycline 100 BD, erythrop 500 QDS, and gentamicin can be added if there is a slow response. Okay. In pregnancy, you will treat with erythromycin 500 QDS. That is the first line. Okay. Azithromycin can also be used. So first drug of choice in non-pregnant will be azithromycin, but in pregnancy you will prefer erythrop 500 QDS. Okay. But azithro can also be used. Okay. Neonatal prophylaxis, if mother had genital lesions, we will give to the neonate also azithromycin 20 milligram per kg for 3 days. So partner management, examine all sexual contacts in the last 6 months. So you have to trace for 6 months. No reliable screening test, long incubation period. Okay, continue until lesions are fully healed. Biopsy if there is no response or suspicion of malignancy. Okay. So how you differentiate Donovaniasis from primary syphilis, chancroid, and LGV? So with respect to the pain, this will be painless. Lymphadenopathy is not common. You get a typical beefy red features, and the organism is a Klebsiella granulomatous. Primary syphilis will be painless. Lymphadenopathy will be there. There will be indurated edges, and trypanosome is the organism. Chancroid will be painful. There will be painful bubo and soft ragged edges. H. ducrei is the organism. LGV will be small ulcer, painful nodes, transient ulcer, and chlamydia trachomatis L1 to L3 serovars. That is what is the okay. So MRCOG examination point of view, painless ulcer which bleeds on touch. Think of Donovaniasis. No lymphadenopathy. That is the important discriminator. The intracellular Donovan bodies, that is diagnostic. Pregnancy, lesions will grow rapidly. Always rule out carcinoma if there is no healing. Continue antibiotics until complete healing. Okay.